As many of y'all know, it's open enrollment for health insurance for 2026, and things are a little bit crazy. Also, things are kind of still up in the air with the government shutdown, and a lot of that having to do with these changes to the costs in the marketplace and around health insurance. So even for myself, as somebody who uses the marketplace for their insurance, specifically Georgia Access, because I'm in Georgia, I'm not entirely sure what to expect, but this is a topic that I feel somewhat passionate about, or I just have a lot of feelings around health insurance. Where do I even start with this? I guess first thing is I'll show you the difference between what I have been paying for 2025 and what, if I stay on the same plan, what I would pay for 2026. So for this year, I have a Anthem plan. This is through Blue Cross Blue Shield. It's a silver plan. My deductible is $4,200. Out-of-pocket max is $7,650. So for 2025, that plan is $564. However, I do have a tax credit because of my income, which brings down my premium, what I actually pay, to $191. Not too bad. However, if I want to keep this same plan for 2026, the monthly premium is jumping up to $754. I would still receive a tax credit, which that also increased, but it is not proportional to how much the overall premium went up. So I would be responsible for paying $347, which is an increase. This is like an 81% increase, $155 more. And I'm going to come back to this because for me, paying this amount monthly, while it sucks, that's not my main concern. Really, everything with health insurance is just chaos to me. I just don't think the system makes sense. I'm also not somebody who is necessarily on board with like free healthcare for everybody, because in those countries where people get access to free healthcare, their taxes are insane. And of course, I would love for people to chime in that are watching this from other countries who do have free healthcare. And if you think it's equivalent, I guess there's no knowing unless you've lived in both countries, or like, in America and some other country that has free healthcare. But from what I can tell, that's not necessarily the answer to the problem that we have here in the States, because then we would be paying way more in taxes. The other thing is, in America, if I want healthcare, if I need a doctor visit or like something comes up, I can go and get a visit sometimes day of. There's urgent care as an option, but even if there's been times in the past when I had a serious medical issue and I wanted to see my doctor, my specific doctor, and they're like, okay, come in today. Sure, they're probably going to be squeezed tight and I may have to sit in the office for a little bit longer, but I can go in and see my doctor probably today if I absolutely needed to. And from my understanding, in those other countries where they get free healthcare, that's not the case. Like, they are waiting months and months sometimes for certain medical things. The other big thing is the difference in care. Now, I'm not saying that doctors in other countries aren't great and they're not educated, but I feel that in America, they kind of will do everything to take care of whatever it is that you're there for. And I'm going to give an example of this. So there was this girl that I used to work with, and she told me this story of how her and her friend were traveling. I think they were in Amsterdam, somewhere where healthcare is free, And her friend, this is gross, but her finger was degloved. So the skin was pulled off of her finger. And this was like some freak accident, and they were abroad, so in Amsterdam or wherever it was that they were. And when they went to the hospital, she still had the skin. They put it on ice, so they had the skin, so it could have been repaired. But at the hospital over there, they completely amputated her finger. While in America, they would try to save your finger and get that skin back on there, and she would probably still have her finger today if she was in the States. So that's what I mean by difference in care, and I think that's because of the way things are set up. I 100% do think that America could do better as far as health insurance and healthcare, all of these things go, especially just around the complexity of these things. So the increased costs, I know that's going to affect a lot of people if this actually does end up being the way that it's going to be. We're going to go through some TikToks, of course. But for myself, like, sure, I'll pay this. I can also switch to different plans. So I see other silver plans that are a little bit cheaper. I could also downgrade to a bronze plan and pay, like, I don't know, $86 per month, that's pretty reasonable. Obviously, I'm going to have a higher deductible, higher out-of-pocket max. And then, of course, there are many people who are insured through their employer, and sometimes the employer covers like 90% of costs or 100% of costs, even 95%. So for employees who have that, there's a pretty significant savings. What's frustrating with the marketplace specifically is how confusing they make these things and making a decision. I know that I could talk with a broker and all these things. The other thing is that I will be getting married in 2026, which is going to help as far as insurance goes, I think. For my fiance's company, which we were just looking at, open enrollment began today. And I've seen people say like, oh, just go onto your fiance's plan. Like, it's not, you can't just do that. So we did ask HR just in case, but you would need to be in a domestic partnership, which in the county that we live in, that is not allowed. So there's like a few counties in Georgia that allow for a domestic partnership, and then otherwise you can't be, like, we're not married yet. And honestly, I'm surprised by what he pays. So for himself, for the PPO plan that he has, which it's also with United, and honestly, I do prefer Blue Cross Blue Shield, but he is paying for himself over $200 on a monthly basis, which is pretty crazy. And then if I were to join him, it's going to be 400 something. So it actually is potentially going to cost more to be under his plan, but it will be a PPO, so we'll see. And I don't know exactly when we're getting married yet. It's probably going to be like May or something. So for now, will likely have to get insurance through the marketplace. What's frustrating to me with the marketplace is the errors that I see. So for example, if I'm looking at the insurance that I have now, I put in all of my doctors, I put in my medication, and it says that certain doctors aren't covered, but that's not true. For example, my gynecologist, who I went to this year with this current insurance, on the marketplace, it says that she does not take my insurance, but that is not the case because I went and sure enough, it was covered. My very expensive medication, I have Crohn's disease, for those who don't know, that is not covered by like anything. So there is always a savings card that I get because of that medication, and that takes care of it. But the amount that is covered by the savings card goes toward my deductible. And so like I've already hit my deductible for 2025, for example. And I mean, not that it's really helped me in any way because I still have an out-of-pocket max of $7,650, which I have not hit that, but that's just, I don't know. It's just really confusing. Like I wish all of this was a bit easier and I could understand the difference between these different plans a little bit better because they just make it so complex. And the other thing is that nurses and the doctors that have to deal with this, they don't even understand it. And that's the part that is frustrating to me because I've had issues with, getting referrals processed correctly. I've had issues with my pharmacy and the savings card. Like there's all these different complex things about my healthcare. And that's what makes me nervous about choosing a plan, like switching plans. I almost just want to stay with this so I don't have to deal with any changes. But I don't want to pay $346 a month. That's a lot of money. And the other thing about American healthcare that annoys me is that we have to pay copays, like $50 for a specialist or $10 to $30 for primary care doctor. Like why? Why do we have to pay for that? I don't think we should have to pay for that if we're paying for insurance. There shouldn't be a copay. I don't know. I know I'm rambling, but that's just my thoughts on health coverage and healthcare in America. And I'm fine with paying this increase, but I'm definitely going to shop around, wait to hear from my fiance's job, and just in case, like we could possibly get on a plan together, even though we're not married yet. But also I'm going to give it some time just to see if the government reopens and kind of the decisions around these increased costs and keeping the savings or not. So I'm just going to play it by ear and not stress about it. Like at the end of the day, if I have to pay this increase, then I will pay it and we'll figure it out, right? But let's go through these TikToks and see what other people are feeling. I have more to say, but I'm hoping it will come up in these TikToks and I'll approach it then. But I, for now, have searched health insurance 2026 in TikTok, and let's go through these.
November 1, first day of open enrollment, I have a bit of advice for you. Do not allow your current plan to auto renew. Okay. Don't let it auto renew without you taking a look at other options. Okay. Other plan options. Now, the rates are going to be higher regardless, but there could possibly be another plan that is going to give you a little bit lower rate than what your current policy is offering you for renewal. Okay. So get with a broker. You can get with me. I'm in Georgia. And yeah. And make sure that you are looking over some other plan options, okay? Looking at your deductibles, your max out of pocket, your co-pays, and all of that. And all of those things could matter in your premium, okay? But do not just allow it to auto renew at the rate that they're offering.
Okay, she is in Georgia. I just might reach out to her. I have had people suggest in the past to work with a broker, and I know it's free of charge, right? Like, I don't know how they make their money, but I am absolutely open to somebody helping me with this and, kind of maybe they know more specifics around what is the breakdown on these different plans, because it looks very, so there's one silver plan that like I currently have for $346, or there's another silver plan for like $200 something, and it's like a different style of insurance, but with a better, like a lower deductible, and it's just really confusing. So then I'm like, what is the catch here? What's the catch here? Is there going to be higher fees because of some, I just don't know the details of it. So I'm absolutely going to take her information down, and I did already start following her. But this is a good tip that you shouldn't allow your plan to auto renew. And even if you have your plan is through your employer, you want to double check and make sure that you're choosing the best fit for you. When I did have my 9-to-5 job, I was always like, oh, platinum plan, let's go with that, because it covered so much. And I only paid 5% of the premium. My company paid the rest. So it was like $30 per paycheck, which was great. Like I will happily pay that. And because they were paying the bulk of it. And I had great coverage. So I still have pretty good coverage. I was surprised that it's been easier than I expected it to, and less of a cost than I expected it to while being self-employed. So I'm grateful for that. There's just now with these changes, it complicates things. I definitely will be reviewing my options before just letting it auto renew me in the same plan.
I just checked our healthcare coverage for 2026 because we got a notification that it would be changing due to the big beautiful bill. And our insurance premium is 400% more than it was in 2025. 400%. That is absolutely insane. All of the co-pays also 400% higher than they were in 2025. My husband works for the state, so he gets insurance through his work, but we had to not elect for that insurance because they had passed something through an EO that said that they would no longer cover his medication. So we stopped doing that, and we got the private insurance to take care of that. Then we get a letter from Planned Parenthood, who was the person that he was using as a PCP at the time, that says that we can no longer see them because of our insurance, because we got it through the And Better Marketplace. And Better Marketplace is not Medicaid. Healthy Connections is Medicaid. But because it was through the And Better Marketplace that we got our insurance, they sent him a letter saying that they would no longer be able to see him for his appointments because of that. I'll find the letter for you tomorrow and show it to you, where it says that, and it specifically says that, the current administration has done this. So I was like, okay, whatever, we're just going to pivot. We're going to find another doctor. It's going to be fine because our insurance still covers all of the medical care that we both need. And then I opened that today to look at it and just see what we're looking at, see what we're dealing with, because I knew it was going to be higher, but 400% higher. Our copays went up for everything too. Every single thing under our insurance has a copay now. And these are not low copays. We're not talking like $10 or $20 or $15. Like, no, we're talking $50, $150 copays. That is fucking insane. Fucking insane. And I don't know what we're going to do, because we both take medication that we need to take to stay alive. To stay alive, we have to take the medication. And without insurance, medication that I take alone, one of them is $830 a month. That same prescription, Hunter also takes it, which is also $830 a month. That's not even counting the two other medications that we both take. The total cost for our medication is somewhere in the realm of like $3,000 a month. And this isn't just our story. This is not just an us problem. So many people that are worse off than we are. And my heart breaks. My heart breaks for them. My heart breaks for everybody, because I don't know what we're going to do, and we're okay. And I can't imagine what it's like for most other people that aren't as fortunate as we have been blessed to be. This is insane. It is so insane. And I'm so sorry that this is the world that we live in right now, that people are debating over whether or not people deserve to have food or health care or access to the things that they need, to these basic human rights. I'm so sorry. This is the world we live in right now. I love you.
So she touched on a good point of, that now my doctor or her husband's doctor isn't taking this insurance, so they can't go see that doctor. And that's what also really annoys me is, oh, that's not in network, so we can't take you. Or if you didn't get the referral, then you're going to have to pay out of pocket for this. And it's like, I have insurance. It just is such a complicated system, and they do everything to make it more and more complicated. And for me too, I really like to see specific doctors. Like, I have my GI doctor, my colorectal surgeon. I've gone to the same gynecologist for years and years and years. I don't want to have to look for other doctors. I like the doctors that I'm with. They have my history. I know that can go to the next doctor, but I know and trust these doctors, so that's who I want to stay with. So that's why I have to pick and choose which insurance. And if they don't take it, also the website is inaccurate, saying that they don't take it or they do take it, and they do or they don't. And it's, yeah. So what is actually true? And I hate that it's set up like that. If I want to go see a doctor, like, just take my insurance, And I know that there's so much more behind the scenes with that and why they take certain insurances, not the others, but it's makes it so much more difficult for us to get care. And yeah, talking about the medication, I don't know what medication she's on, her and her husband, to stay alive. For myself, my medication, I wouldn't die without my medication necessarily. I have Crohn's, as I said, and I am on the biosimilar version of Humira, which Humira is $7,000 plus per month for two injectable pens. So I'm on the biosimilar, which is about $2,000 without insurance. And people say, oh, check on GoodRx, check on these others. They don't cover it. It's more expensive on there than to go through my insurance and all of that. So I have the savings card. My insurance doesn't cover that medication whatsoever. And then I have the savings card that helps with it. And sometimes I have to pay I don't know, even that is a whole mess. Like, it doesn't make sense. And I remember one time I called the pharmacy and I was saying, like, it wasn't getting covered, so I would have had to pay like hundreds of dollars, I don't know, like $400 something in order to get my medication. And I had called saying, like, I haven't filled it because it's not being paid for, so I had to skip it 1 week. And she was like, oh, don't ever skip your medication. Or I had skipped it for something so that I could have it, like, make sure I had it. So I was like, oh, instead of every 2 weeks, I started doing every 3 weeks, whatever. And I told them this, and they're like, oh, don't ever do that just because you... Like, I can't pay for it, though. Like, what do you mean? This is what it comes down to. I remember seeing a story, I think it was maybe earlier this year or last year. There was a kid who died because he couldn't afford his medication. I think it was for diabetes. No, it was for his asthma. I think it was for his inhaler. And he ended up dying because he couldn't afford the inhaler. And they didn't... It gets confusing. So a lot of times people don't know what questions to ask, or the pharmacy doesn't help, the doctor may not help, it just gets confusing, or you run out of time, you're at your wit's end. Like, it gets really frustrating. I've been brought to tears so many times when having to deal with the pharmacy and things aren't going right and it's not being paid for properly. And then they're like, oh, you actually have a copay of $450. Would you still like to refill it? Otherwise we can wait. And like, no, I don't want to fill it at that price. I'm not paying that. And so I can imagine that's what that kid was going through as well. And I think he was mid-20s, so not even a kid. But I don't think he told his parents. So then he ended up dying because he couldn't afford his inhaler, which, yeah, this is so upsetting. That's the problem with America's system, is it is complicated. And for a lot of people, the options aren't there. And the other thing too is that it adds just this layer of stress, and it gets frustrating to have to be on the phone call. And then when you call the pharmacy, when you call the doctor, you're on hold, or people don't call you back, you're leaving voicemails, and then you kind of just spin in circles. There were many times that they were like, oh, you actually need to call your insurance. I'm like, I literally just got off the phone with my insurance and they told me to call you. And now you're telling me to, and you have to try to keep your cool, it's not those people's fault, but yeah, I'm getting worked up just thinking about it now. So 400% is a lot though. Mine's 81% higher. So I know a lot of people are seeing big jumps, and I haven't seen 400% yet. So that's new.
So open enrollment began this weekend, and I was crunching the numbers, trying to see what our monthly and annual health expenses are and what we're paying in premiums. And I'm not beyond doing health share options, but you guys, health share and regular insurance would cost us the same thing per month. Not necessarily in premiums, but in like overall health expenses. So health share premiums are slightly cheaper. They're not even that significantly cheaper. And you have to hit your minimum threshold and then have your it's like for emergencies. Well, if you don't have emergencies and you just have like your regular upkeep stuff, that upkeep raises its own prices, and then you're paying out of pocket for that stuff. And by that time, you might as well just be paying the regular insurance premiums. And for reference, between me and my husband for the year, premiums and health-related costs have exceeded over $20,000 for this year. And we still haven't hit our deductible. We still haven't hit our out-of-pocket max. It's just crazy. I don't know what to do because there is no cheap option at this point. The cheap option would be to risk it, do a direct to primary care program with an office out here, and then just not carry emergency health insurance and just like hope and pray that we don't have emergency or get diagnosed with something terrible.
Yeah, and I think this is what a lot of people are going to do. They're going to become uninsured. I see in the comments, somebody said, mine is going from $58 to $581 per month for the same plan. The plan with the lowest monthly premium is $421, but the deductible is 40% of my annual income. I'm just not going to have insurance anymore. To me, I'm not willing to risk that. I think having insurance in America is a must, unfortunately, because sure, paying out of pocket, just paying self-pay at the urgent care, at the doctors, anywhere that you go, is fine. But if something catastrophic happens, or if anything major happens, you get diagnosed with cancer or a disease, my dad this year, he fell off of a ladder. You're not expecting for those things to happen, of course, but that cost him so much more money. He had multiple surgeries. He stayed in the hospital for days. He had surgeries. He had doctors coming to the house. Like, all of these things, if he didn't have insurance, would have cost him I don't even know what it's at now, but at least tens of thousands of dollars, probably $100K. And I've seen people talking about getting diagnosed with cancer and the cost of care with that, like running millions at that point. So for me, it is not worth it to go without insurance, unfortunately. I'm not too familiar with these like other health programs, but yeah, it does. If you're somebody who has like a situation like myself where you have these specialist doctors you need to go see and medication that that is very expensive, then to me that's not really an option. Like, I have to have insurance, but I don't think it's smart to go without insurance in America, and I'm scared that so many people are going to do this. And you could say, oh, I'm just not going to pay, but it does affect you, unfortunately. And you could file bankruptcy and maybe get rid of it by doing that, getting rid of medical debt like that, but it's not guaranteed. And also it just messes with your credit. It can potentially ruin your life. It just adds more financial stress. And I don't know. What's the solution, y'all? What is the solution? Somebody else commented, United is $2,400 per month for us, plus a $10,000 deductible. My health insurance is going from $1,400 to $2,600. My mortgage is $1,400. Wow. Let's go to the next one.
So, folks, this is what the current fight is all about. Nobody wants to shut down. At least I don't. I don't want to shut down. But what I also don't want is for people in Georgia that I represent to lose their health care because it's simply unaffordable. Let me show you what I mean. In 2025, this family of four in Chatham County, where I grew up, paid $559.69 per month for the lowest cost option. That's the lowest cost. Family of four, $559.69 a month. Now look at this. Because of Republicans' cuts to health care last summer, the same family will have to pay $2,131.65 for the lowest cost option. You tell me how an ordinary working family in Georgia is supposed to afford that. Republicans did this. And right now, they won't reopen the government because they're fighting for this. Well, I'm not fighting for Georgians to have their health care premiums quadrupled. I'm fighting to extend their health care and to reopen the government. My Republican colleagues ought to join me.
Again, this is specific to Georgia. So Anthem Blue Cross Blue Shield is definitely not the cheapest option. This is the cheapest option with Anthem. But Anthem, and the reason I guess he's focusing on this is because he knows somebody who's on this plan, and probably people think similarly like I do, to where all the doctors take Blue Cross Blue Shield. Like I've never gone to a doctor and they're like, oh, we don't take Blue Cross Blue Shield. Like that's basically unheard of in Georgia, and that's why I prefer Blue Cross Blue Shield, because it's like the safer option. It's not the cheapest though in the marketplace. There are other alternatives, and you can pay, like for me, for example, I saw plans for like $50 something, but then you're gonna have a hard time. The deductible is insane, and you're gonna have a hard time getting doctors, the doctors you want anyway. So it's a little misleading as far as that goes. The other thing I just noticed is, do you see this? $559.69 per month after $1,247 in savings. They're getting a tax credit. And so that's not on this side. That is not on this side, is what I'm making of that. Yeah, so they were paying $1,806, and then they have this tax credit, and it's jumping up to $2,131 without the tax credit. And so this is actually an increase of the $500. So yes, it's still an increase, but it's not quadrupled. So this is inaccurate based off of what I'm seeing.
It's open enrollment season, so you know what that means. It's time to make important decisions about your health and financial benefits next year. Now, a lot of people just hit renew without realizing that one, they're leaving money on the table, or two, that they're paying for a plan that's costing them way more than it should. But I'm Natalie. I talk about all the ways to optimize your finances, so here's what you're going to want to look out for. One, check if you're eligible for a health savings account. Your contributions are tax deductible, your money grows tax-free, and withdrawals for qualified health expenses are tax-free too. This is essentially why they call it a triple tax advantage account, and plus it doubles as an extra retirement saving vehicle too. Some employers will even match some contributions into this health savings account. My husband's employer actually contributes $1,000 into the health savings account. Second, don't overpay for coverage. I would run the math on premiums, deductibles, and out-of-pocket maximums, because sometimes the plan with a cheaper monthly payment actually ends up costing way more when you use it. And third, compare the insurance providers that are available to you. We all know that not all insurance providers are created equal, and some deny claims more than others, which can leave you fighting bills that you thought would be covered. Cough, cough, United Healthcare. This is exactly why we made the switch to Premier Blue Cross, so we can get better coverage and fewer headaches.
This stresses me out because my fiance's health insurance through his employer is United, and I haven't heard great things. I haven't heard great things about any insurance company really, but as I keep saying, Blue Cross Blue Shield has been who I've been with for like my whole adult life. So I don't even know. I don't know if I want to go in his plan, to be honest. I don't know that it's going to save me. I don't know if y'all saw that tip that popped up about ChatGPT. I do recommend doing that. If you're looking at your plans and you don't understand the difference, if you don't know what the 0% coinsurance after deductible, if you don't know what that means, obviously you can just Google it, but ask ChatGPT to take a screenshot, put it into ChatGPT and say, can you break this down, compare it to this plan, explain everything to me like I'm a 5-year-old. I do highly recommend doing that because it gets confusing, and I do that myself. So if there's any, I'm going to go through and compare things and see if I were to get this plan, truly how much would it cost me if this, I'm going to go through and do that with ChatGPT because it's very helpful. Sometimes we miss things. And she did mention checking the doctors, making sure that they take your insurance. But as I mentioned before, in the marketplace, that has been inaccurate. So that is a little bit more challenging. I have to pause this because it's playing music, but it says, just saw the price of my health insurance for 2026, single, healthy, low copay plan, and it's low copay plan. That's usually a good thing. And it's $400 a month, so I think I'm just not going to get health insurance. I work in healthcare BTW. I remember seeing a couple of people in my comments when I brought up health insurance saying how they work at a health insurance company or in the medical field and their insurance is trash, which is insane. I mean, even seeing what my fiance is paying for his health insurance, to me, it was a lot. Like, he's paying more than I am. And I want to say I pay a little bit less as far as co-pays go. It's just interesting how that works. And then I know that there are some companies that don't give health insurance, or they may give you money. Like, I know for my dad, he's worked at the same employer for like decades now, and they don't have health insurance for the whole company, which sucks, but they do give him money on a monthly basis, so he does have to go through the marketplace. I know that's the case for a lot of people, and this is the last year that he has to go through the marketplace, because then he'll be able to get on Medicaid. I know he's been stressed about it because, one, he had Aetna, which that's being dropped from the marketplace, at least for Georgia, and then everything else is really, really expensive for him. So, yeah. Somebody commented, I've had it for 3 years and it's been cheaper for me to pay out of pocket for my annual visits, just saying. Which, yes, if you go to the doctor and say to them, oh, I'm going to pay self-pay, then you're going to pay like $100 to $200, right? Just depends on where you're going. And this is even at a specialist doctor. However, if you run things through insurance and you look at that claim, they are billing the insurance like $600 plus. And then you're still having to pay a copay and potentially other fees depending on what went on. So yes, I do think being uninsured is more affordable if all goes according to plan. If you are healthy, if nothing crazy happens, you don't get in a wreck, you don't fall down the stairs or get diagnosed with a disease or cancer. So it's just a risk. It's a gamble.
Hey folks, I want to give you a little insight as to what these healthcare costs are going to be next year if you buy your healthcare off of the exchange. For a family of four living in Maricopa who makes $82,000 a year, it's going to cost $754. Last year, that was $167. And for a couple in their 60s in Prescott who make $54,000 a year, their healthcare is going to cost $878, where it was $154. Those are huge increases, and for many people, it's unaffordable. We're trying to fix this. We are standing up for what's right. We're trying to reduce your healthcare costs. Unfortunately, my Republican colleagues wanted to give a big, giant tax cut to rich people, and they're paying for it partially by raising the cost of your healthcare. That's what this fight is all about.
All right, so yeah. Oh, geez. Okay, and look at the deductible too. That's so high. This one mentions having the tax credit. I'm assuming, yeah, that's in there too. I don't talk about politics on my channel ever. I'm also not huge into politics, and obviously this is a big, a big political thing going on. He did mention tax.
Republican colleagues wanted to give a big, giant tax cut to rich people, and they're paying for it partially by raising the cost of your.
Now, as far as the really wealthy people, the billionaires, I'm not sure. You know, you made your money. You made the money. We're talking Elon Musk, Jeff Bezos, you know, those people. They made their money. So who are we to say what they do with their money? But truly, I don't think anybody needs to be a multi-billionaire, almost a trillionaire. Like, think of what they have, so much power because they have money, and think of how much they can make a difference in the community, in the country, if their money was put to use in a different way. If they gave up some of that money. You know, it's just crazy to me. That's one area that I'm not entirely sure how I feel about it, and I guess what I'm saying is I don't think that multi-billionaires should be a thing. And truly it comes down to that person as an individual. I know a lot of their money is tied up like in the market or in their businesses, and that's a bit different. But even if it was like hundreds of millions of dollars that they have, that they are able to it just shows their character. It shows who they are as a person. There are lots of wealthy people that do give their money to causes that they care about, and it's crazy. But all right, let's just do a couple more. Let's see what else we got.
I just got a letter in the mail from Blue Cross Blue Shield letting me know that my medical premium for 2026 is going up to $882.64 a month. That, included with my dental and my vision, means I'm going to be paying more than $900 a month just to have health insurance. And that's all out of pocket because I don't have a company that pays for my health insurance. So, I don't know how people are surviving with kids. I really don't get it. This is insane. And if anyone has suggestions on other health insurance companies that are better or more affordable, please let me know, because this is highway robbery. Anyways, I just got these new glasses. Aren't they cute?
Little cat's cute too, purring. Somebody said if every one of us drops our insurance and puts the money we would have paid in a separate account, insurance companies will have nothing. Yeah, you wish if everybody were to be on board, but it's obviously not easy to do that. Lots of people suggesting get rid of the insurance, just do self-pay, which we've already talked about. Some people saying get a part-time job at supermarkets or other places that have insurance and pretty good insurance, which that's, somebody mentioned Winco. I think Costco is good as well, but I think you have to work there full-time. I know like Chipotle and Starbucks, they give you health insurance if you're part-time, I'm pretty sure. But it's like not everybody can go and work at these places. Somebody suggested make all of your appointments before the year ends, which, you know, that's one thing, but it doesn't really work like that. Like if you already went to an appointment in like an annual, for example, you can't do that again in the year. You're going to have to pay for it, or it's just not necessary for you to do that. And then some things do just take longer to book out. But okay, let's do one more.
It is time to see if my healthcare costs went up this year. I am pretty sure that it did, but let's go ahead and take a look. I'm in private practice, and that is probably like the worst thing about being in private practice is you have to pay for your own health insurance. So this year, let's see, let me log in. I get my health insurance through the healthcare marketplace, like the healthcare exchange. And right now I am paying $440 a month. I am healthy. I'm 34 years old. No major illnesses I'm being treated for. And with that, I have a $6,000 deductible that I need to meet. I really don't like my health insurance. So honestly, I'm looking at changing it right now. But so if I stay on my current insurance plan that I have, which again, $6,000 deductible, it would increase by $100 a month. That is a 20% increase for the entire year. I absolutely hate my health insurance. But when I look at the plans, the cheapest one that I see is $400 a month, and that's an HMO plan, and that's got a deductible of $7,200 per year, which is still pretty crazy. Yeah, pretty much my options as I'm looking at these are, I don't know. I am stuck between going with a plan that has a very high deductible or one without a deductible. I feel like I'm really torn.
So I'm going to stop here. And that's not a bad increase compared to even 81% is what I'm seeing. And then a lot of people seeing, you know, double, 200%, whatever the case may be. Your deductible is important, but I would say even more important is your out-of-pocket max, because that's truly what you're going to be paying. Like once you hit your deductible, you pay a little bit less, like you're going to be charged a bit less, but you're still going to have to pay. And then that out-of-pocket max, if it's like $20,000, that means you potentially could be paying $20,000 of healthcare. And that's if those, like all the things get applied to your deductible and out-of-pocket max. For myself, this is definitely something I'm still going to be, one, I'm going to wait on to see what happens with the government shutdown, and if they can come to an agreement on this, and maybe these subsidies will get continued at least for another year, and we won't have to worry about this. But I don't know what they're going to do about if people already go ahead and enroll in something, but then things change, and yeah, it just depends on the timing as well, I suppose. Either way, I'm absolutely going to shop around. I think I'm going to reach out to that first lady that we saw who's in Georgia. She's a broker, and hopefully I can get in contact with her and see if she can help me to shop around. Maybe they can see things better than I can. And then I know this isn't the case for everybody, but I am getting married next year, so I can probably go with a plan with maybe like a higher deductible for the first few months, and then I'll get onto his plan, which has a much lower deductible. And I think that's kind of where I see the positive, like at least there's that. So if I went on his plan, there would be a $2,000 deductible and I think the out-of-pocket max, I can't remember what it was, maybe $3,000, but much lower than what I currently have. And that's with if I stick with this plan. So if I were to switch to another plan, then my deductible and out-of-pocket max would be higher, and that does make me a bit nervous. So I have the money to pay for it if absolutely necessary, but if I can switch and save, then I would do that. But yeah, it's crazy out there. I would definitely be interested in hearing how much yours increased, if it did, and kind of what the situation is. Like, do you get it through your employer or through the marketplace? And yeah, would just love to hear any details. I know things are a bit stressful for now, but I am hopeful that things will eventually settle down. Yeah, we'll see. But anyways, thank you all for watching. Please give this video a thumbs up, subscribe if you haven't already, and I'll see you in my next one.